Fayette, Lauderdale, and Tipton. All right. So on the next page, it says, what is Tennessee SHIP? Tennessee SHIP helps Medicare beneficiaries in Tennessee understand Medicare and find the best possible plans available to them right where they live. Our four main areas are outreach, education, counseling, and lastly, assistance. So what is SMP? What is Senior Medicare Patrol? Lonnie is going to pretty much focus, I wouldn't say solely, but she's going to focus on SMP. But a long story short, it just helps Medicare beneficiaries prevent, detect, and report healthcare fraud. It helps preserve the integrity of the Medicare program, and it also relies on volunteers to help perform SMP work. As I said a few minutes ago, Lonnie is going to focus on that. What is Medicare? There's a lot of questions about Medicare. Exactly what is Medicare? Okay. Medicare is health insurance for persons who are 65 years of age and older. It's for people under 65 with certain disabilities. People of all ages with end-stage renal disease, ESRD, and of course it is run by the Center for Medicare and Medicaid Services, or CMS as we call it. Sign up. If I'm going too fast, just let me know. No problem at all. Sign up with the Social Security Administration or the Railroad Retirement Board. And worth noting, Medicare is not the same as Medicaid. Medicaid is state to state. Medicare is federal. So when we're talking about Medicare, we're talking about the four parts of Medicare. And am I the only one hearing a lot of feedback?
Yeah, I'm trying to get rid of that. Just give me a second. Okay, Marcus, if you can hear me, you might have to unmute yourself by going to the mute button and unclicking it, because I tried muting everybody so that we wouldn't get that much feedback. Marcus, can you hear me?
Now mute myself.
Okay, so okay, good. So if you unmuted yourself, you should be able to go on. I've got everybody else, I think, on mute.
Sounds good. Okay. So what are the four parts of Medicare? Part A is our hospital insurance. Part B is the medical insurance. And Medicare Advantage, that's your Part A plus your Part B, and it usually covers your Part D, which is the prescription drugs. Is that better?
Yeah.
Okay.
Go ahead. Okay.
So, what is the Medicare Advantage plan? What is the Medicare Advantage plan? It's the health plan options, and of course, they are approved by Medicare, and they are run by private companies. Part of the Medicare program, and it sometimes is referred to as Part C, which is inclusive of Part A and Part B equals C. And of course, it's available across the country, and it provides Medicare covered benefits, and it may cover extra benefits. I know you see the commercials with Joe Namath, and you see the commercials with some of the senior population, and talking about all the different services that they provide, like free meals, and of course, now we know the Give Back program. So that may be inclusive of some of the extra benefits. The next page is, how does the Medicare Advantage plan work? Medicare Advantage plans, they receive services through the plan. All Part A and all Part B cover services. Some plans may provide additional benefits. Most plans include prescription drug coverage, and you may have to visit in-network doctors and hospitals, and it may be a little bit different than original Medicare regarding benefits and cost sharing. So, how does the Medicare Advantage plans work? You are still in Medicare, not anything separate. You're still in Medicare, and you still have Medicare rights and protection. So you are still covered. And if the plan leaves, just say the plan leaves Medicare, you can join another Advantage plan, or you can return back to the original Medicare. And I'm on page 149 of the handout. The Medicare Advantage cost, you still pay the monthly Part B premium. A few plans may pay all or part for you. And of course, state assistance may be available for some. You may pay an additional monthly premium to the plan, and the plan deductibles, the co-insurance, the co-pays, they're different from original Medicare. It may vary from plan to plan. It may be higher if out of the network and out of pocket spending. And the last section that I want to present on is who can join the Medicare Advantage plan. The eligibility requirements: you must be enrolled in Part A and Part B, and you must live in the plan service area. You must be a United States citizen or lawfully present in the United States, and you cannot be incarcerated. You can't be locked up. To join the plan, you must also provide necessary information to the plan. You must follow the plan rules, regulations, and guidelines, and you can only belong to one plan at a time. You can't belong to two. You can only belong to one plan at a time. And that's the portion that I was presenting on. I'm going to hand it off to Ms. Franklin.
Thank you. All right. Thank you for going over that initial part. So now we're going to segue into how to enroll. Now that we know who can join, now we need to know how you can join. So the different ways that you can enroll in a Medicare Advantage plan. So the first way is the initial enrollment period, or IEP. And this refers to two types of periods. The first one is based on your birth date, because as you may or may not know, Medicare is typically based on your birthday. Marcus mentioned earlier that is primarily for people who are age 65 and older. So you have a 7-month window that's going to start the 3 months before your birthday month, is going to include your birthday month, and then it's going to be the 3 months after. So for instance, we're in the lovely month of January, and yes, I am prejudiced because it's my birth month, but if your 65th birthday is in January, then that means your initial enrollment period would start in October, and that it would go through the end of April. So that's your initial enrollment period for Medicare itself. And during that time, not only can you sign up for Medicare Parts A and or B, but you can also sign up for a Medicare Advantage plan. The other way you can have an initial enrollment period is if your Medicare is based not on age, but on disability. There are people who are under age 65, and due to certain disabilities, they've been certified by Social Security, and they receive Social Security disability insurance. In that case, you can become eligible for Medicare once you have had Social Security disability for 24 months. So that means the 3 months before your 25th month of eligibility, that 25th month, and then the 3 months after. So you still have a 7-month window in which folks who are on disability will be eligible for Medicare. And during that time, they can also sign up for a Medicare Advantage plan. Oh, that's some feedback. All righty. And so now when it comes to disability, you may know people, heaven knows I've had them in the family, where that eligibility can be backdated. So it is possible, if you've been waiting a mighty long time for them to make a decision, you might get the decision in April and they've already backdated it a couple of years. So you might be like, I don't have to wait 2 years. That's because they backdated it. So that's why we call it your 25th month of eligibility for Social Security disability. Whenever they tell you you were eligible, count those months. So that's when you can enroll in a Medicare Advantage plan. Another time when you can enroll in a Medicare Advantage plan is our annual enrollment period, which we just finished up with towards the end of last year. That is October 15th through December 7th. That's every year. That's when you are able to join, switch, or drop a Medicare Advantage plan. Yes, that is also the time when people are looking at Part D plans. So those two happen at the same time. So annual enrollment, October 15th through December 7th. So if you don't have an Advantage plan and you want one, you can get it. If you want to switch to a different one, you can do that. If you want to drop it all together and do something different, that's that time, annual enrollment. We do have a couple of other times when you can join Medicare Advantage plans. There is the Medicare Advantage open enrollment period. And this is only for people who already are enrolled in a Medicare Advantage plan. That starts January 1st, so it's already begun at the beginning of this month, and it goes through March 31st. So if at the start of the year you are already in an Advantage plan, you can use this period to make changes. You can change your Medicare Advantage plan, or you can go back to original Medicare and you can pick up a standalone drug plan if you wish. So that's this period, January 1st through March 31st. They restarted that back in 2019. It's something they used to do long ago, and then they dropped it, and then they brought it back in 2019. So this is our third year of having this recently, the Medicare Advantage open enrollment period. Now, there is no guaranteed issue right for Medigap. So and we're going to talk a little bit about that later, but if you had dropped a Medigap plan or supplement insurance, and then during this period, you want to get rid of your Medicare Advantage plan, this doesn't mean that you automatically have the right to get your old Medigap plan back. But this is the time where you can make those changes. And then we have what's called special enrollment periods. There's several reasons why you may qualify for a special enrollment period, and that's going to be on the next slide. So here's some of the reasons you may qualify for a special enrollment period. Let's say you move out of your plan's service area. A Medicare Advantage plan is going to it can only be sold in a particular area. So if you live here in Shelby County, where I physically am, then there are plans that you can purchase that may be different than, say, if you're in Fayette County, or let's say even a little farther out, Davidson County, Knox County. I'm running out of counties of Tennessee, I know. Anyway, Mississippi, there's a state. So if you move out of your plan's service area, that means you will need to get a plan that is in your new plan where you live. So in that case, you will have a special enrollment period. They're not going to force you to wait until October 15th if you move to Poughkeepsie on March 27th. You will have a special enrollment period based on the fact that you moved. If you lose other creditable prescription coverage. So what that means is if you have prescription drug coverage outside of Medicare, but that is considered creditable by Medicare, then you don't have to get a drug plan or a Medicare Advantage plan that has drug coverage. So for instance, if you or your spouse is currently working, and so you have insurance through your job, and that insurance has drug coverage, that would be in most cases considered creditable. So you may have chosen not to get a Medicare Advantage plan that has drug coverage or a standalone drug plan. But if you lose that for, whatever reason, you or your spouse loses that job, so therefore you lose that coverage, then that gives you a special enrollment period to pick up a Medicare Advantage plan with drug coverage. Let's say you weren't adequately informed that your other coverage wasn't creditable or it was reduced and is no longer creditable. So for instance, you have a plan and it was creditable in 2020, but they made some funky changes and now in 2021, it's not creditable. They're supposed to let you know that in writing so that you can go and change, make a decision about getting Medicare drug coverage. If you weren't adequately informed of that and you can prove it, then you get a special enrollment period. Let me go back to creditable prescription coverage. So not only coverage through your job's health plan, but that can also include if you have VA prescription coverage, TRICARE prescription coverage, even most retiree plans prescription coverage. But again, you want to make sure in writing that it is deemed creditable, or else you might fall into that third bullet point. Another reason for a special enrollment period, if you live in, or leave a long-term care facility, in that case, you will get a special enrollment period. And that happens because you may enter a facility that does not take your current Medicare Advantage plan. And so they want to give you the ability to switch to a plan that will work with your new living situation. If you're in you or your loved one is in a long-term care facility, or even go back to original Medicare if that's necessary in order to receive treatment at that facility. If you have you can have a continuous special enrollment period if you qualify for extra help. So Marcus mentioned earlier that sometimes you may be able to get help with your premiums or your co-pays with the Medicare Advantage plan. And that would be if you qualify for low-income assistance and you can get extra help. That's the program, or low income subsidy from Social Security. There's also some Medicare savings programs that you would be able to get from the state if you qualify. So if you are in either of those situations, then you have 4 special enrollment periods in a year, and they're based pretty much on the calendar quarter system. So January through March would be a quarter. April through June would be the second quarter. July through September would be the third quarter. Now that fourth quarter is just a little bit different. They made some changes. That fourth quarter, you would just use the annual enrollment period that we talked about earlier, October 15th through December 7th. So that would qualify as your quote unquote fourth quarter. But those 4 times a year, you would be able to make changes if you receive extra help. If you belong to a state pharmaceutical assistance program, there is no such animal in Tennessee. However, if you're listening from out of state, or you're going to give this information to your out of state buddies, they may have state pharmaceutical assistance programs. And if so, they would qualify for special enrollment periods. And then some other exceptional circumstances, sometimes just wild and crazy things happen. You might be able to call Medicare and see what they can do for you. So another situation which might qualify for that wild and crazy thing would be if you're in a low performing plan. So if your Medicare Advantage plan has been rated less than 3 stars for 3 years in a row, that's considered low performing by Medicare. And you'd be able to know that on the Medicare Plan Finder, which you can see on Medicare.gov. Also, you can call SHIP and we can look that up for you. We use Medicare.gov all the time. And as you look through the plans, if you see this icon, this little upside down triangle, well, I guess depending on your perspective, it might not be upside down. This little red triangle with the exclamation point, that's going to let you know that this plan has been flagged by Medicare as having fewer than 3 stars for 3 consecutive years. So if you're in that plan and you're like, oh man, I'm in a low performance plan, you can make changes. You can say, hey, I want out of this. And you have a one-time option to switch from that plan to a plan that has 3 stars or better. And that can be anytime during the year that you realize that I'm in a low performance plan. Darn it. You can make that change. And you can trust that icon on the website because plans are not allowed to discredit their status. They're not supposed to, like, say if you go to, and I'm going to make up a name so I don't malign anybody. Let's say you go to the Adrienne Franklin Medicare Advantage Plan website, and I pretend that my special Medicare Advantage plan, oh no, ignore Medicare.gov. You could ignore that little triangle with the exclamation point. That's not true. We have a great rating. We've got 4 stars. They're not allowed to do that. And in fact, if you do see that, call Medicare and report it. They cannot discredit it. So that's a special enrollment period for you. Another special enrollment period would be the 5-star special enrollment period. So let's say that there is a 5-star Medicare Advantage plan or a 5-star prescription drug plan. You notice it and you're like, I want to be in a 5-star plan. You can enroll in that plan at any time during the year. Well, actually, I think it's usually through November. But you can enroll anytime during the year, get out of your plan and go to this 5-star plan. You can only do this once in a year. And your new plan will start the first of the month after you sign up. Now, I'm just going to tell you, we don't have one of those in Tennessee. We used to, but it's now 4.5 stars. So you're not going to be able to do that this year, but maybe if they go back up, you'll be able to do it. I actually helped someone 2 years ago, so I do know that it's possible. I helped someone get into a 5-star Medicare Advantage plan. So if you are in a service area, and I shouldn't say in Tennessee, let me take that back. In this area, Shelby, Fayette, Tipton, and Lauderdale, which is what we serve, there we don't have a 5-star Medicare Advantage plan anymore. But if we ever get one back, you can take advantage of that. And they rate these every year. So in October, when it's time for annual enrollment, they reevaluate and they put out those stars, and you'll be able to see if there's a new plan that has in estimation. All righty. So now we're going to, if you could mute your phone. I think we're getting some feedback from someone. So if you could mute your, if you should be able to see by your name, there's a little microphone icon. You just click that. Thank you. All righty. So Medicare Advantage, trial rights, and Medigap. So Medigap, that is another term for Medicare Supplement Insurance, which you can only get if you're on original Medicare. Those are those plans that you go out and get, those private plans that help you pay for your co-pays and some of your deductibles for Medicare A and B. So people on original Medicare may have a supplement plan. So how that relates to Medicare Advantage plans is, let's say you just turned 65 and you decide, I'm going to go with a Medicare Advantage plan. So you do that. And you decide, I think I want to go back to original Medicare and I want a Medigap plan. If you do that within the first 12 months of having your very first Medicare Advantage plan, you just turned 65, you just did this. So if you do that within the first 12 months, you can switch back to original Medicare and you will have a 2-month guaranteed issue right to get a supplement policy, also known as Medigap, where they will not be able to do medical underwriting, means they won't be able to ask you questions about your health in order to determine your eligibility or in order to determine your premium. So you're still going to get the best available rate for someone of your age at the time you ask for it. So again, that's if you just turned 65, joined Medicare, got a Medicare Advantage plan, and within the first 12 months decided you want to go back to original Medicare and you want to pick up a Medigap plan, you can do so with a guaranteed issue right for 2 months to be able to get the best available rate, as opposed to get one based on your health condition. Also, let's say you've had original Medicare this whole time, you've never had a Medicare Advantage plan, you've had an original Medicare, and you've had a Medigap. You decide you want to try a Medicare Advantage plan because Sally Sue next door told you it was great. So you decide to try it. And within 12 months, you decide, I want to go back to my life that I had before I met her and get an original Medicare plan and get my Medigap plan back. You also will have a guaranteed issue right to get that plan back. In fact, we helped someone last year figure out that entanglement. Otherwise, if you have had a Medicare Advantage plan for longer than 12 months, or this is not your first Medicare Advantage plan ever, then you're not going to be able to have that guaranteed issue right. Doesn't mean that you can't go back to original Medicare during annual enrollment or during that Medicare open enrollment period. Doesn't mean you can't go back to original Medicare, and it doesn't mean that you can't try to get a Medicare supplemental plan. It just means that you won't have a guaranteed issue right. That means that you will be subject to medical underwriting, and they can determine eligibility, and they can determine premiums based on any previous health conditions you may have had. All right, we're going into my final phase before we get to Lonnie's part. We're going to go over types of Medicare Advantage plan. And the 3 types we're going to talk about today, there are a couple of others, but really in our service area, these are the 3 you're going to run into. Health Maintenance Organization, or HMOs, Preferred Provider Organizations, or PPOs, and Special Need Plans, or SMP. So HMOs, and this is really going to be similar in some ways to, when you had insurance through the job, you had HMOs and PPOs then too. So can you get your health care from any doctor or any hospital? And the answer is nah. With an HMO, that's going to be your most restrictive type of Medicare Advantage plan, where you do have networks and you must get your care from an in-network provider, whether that be a doctor, a clinic, a hospital, who have you. You must use someone in-network, or you're not going to be covered. The only exceptions for that is if it's an emergency, if you're getting out of the area urgent care or out of the area dialysis, they're not going to hold you back. So, if you're on dialysis and you've got an HMO plan and you live in Memphis, but you're visiting your friends in California, they will let you go to dialysis. They're not going to hold that up. Or let's say you're visiting someone in New York and, there's a car accident. Well, no, that's BACS. That'd be car insurance. You fall down the stairs and they got to take you to the ER. That's going to be covered. Otherwise, you need to be in network. Or else you're not going to have coverage. Now, there are a few types of HMO plans called HMO point of service, where they will allow you to go out of network if you pay certain copays, higher copays. So there's a specialized category, but for the most part, you need to stay in network. Yes, prescription drugs are covered in most cases. Most HMO plans do have drug coverage provided. There are a few that may not. So you always just want to make sure. They say you can ask the plan. Also, you look on Plan Finder. It will definitely tell you if a plan provides prescription drug coverage. In most cases, yes, you will need to choose a primary care doctor so they can print that on your card. If you don't choose one, they're just going to put somebody down on your card. They'll just pick them at random. Doesn't mean you can't change it and call them and go, hey, who is this guy? I want to get this person. And as long as the person you choose is in their network, that's fine. Do you need referrals to see specialists? In most cases, yes, you'll need referral, as well as prior authorization in most cases with an HMO. Now, as it mentions here, there are some preventive services, like your yearly screening mammograms, where you won't have to get a referral. You still want to make sure that you get that service, however, in network, so that you can get your preventive services. And then what else you need to know? If your doctor or healthcare provider leaves the plan, your plan needs to notify you of that. So let's say you're seeing Dr. Bombay, and Dr. Bombay leaves your Medicare Advantage HMO plan. Your plan will let you know so that you can go find a new doctor. That's not a reason to leave the Advantage plan, however. If it's June and you don't have a right to any other special enrollment period and Dr. Bombay leaves and you want to keep him, then you're going to pay more, or you need to find a new doctor that's in your network. You won't be able to leave the plan just because your doctor left, but they will notify you that the doctor left so you can get a new doctor. If you get healthcare outside of the plan's network, you will most likely have to pay the full cost. Again, there are those exceptions I mentioned earlier, and you want to definitely make sure you follow the plan rules. I've seen some cases where people didn't get coverage, not because they weren't entitled to it, but because they didn't follow the rules in order to get that coverage. And your plan may have special rules, and they should send out a book that will list everything, rules such as you need a referral, or you need prior authorization, or they may have limits on how many times you can get a service before you have to get authorization again. They're not saying they won't give you the service, but they want you to basically jump through the hoops. They want you to follow their rules so that you can get the services that you are entitled to. The next type of Medicare Advantage plan would be the PPO. This differs from the HMO. It's a bit more flexible. In most cases, you can go outside of the network, but you will have a higher copay. So it's still cheaper if you stay in network, just like with an HMO. You'll save more money if you stay in network. But if you have to go out of network, in most cases, you should be able to get service. Just know that you will pay a higher copay. Also, let me mention with Medicare Advantage plans, they generally have areas where you can where you can use the plan. That's different from getting a plan based on where you live. The plan, getting it based on where you live, just tells you that they're allowed to sell it in your city, in your county, in your state. But then when you pick a plan, you want to find out, so what areas can I go and use this? Do I have to stay in Shelby County? Can I go to Fayette? Do I have to stay in Tennessee? Can I go to Michigan? And that's going to vary plan by plan. So you definitely want to check. And that's true no matter what type of Medicare Advantage plan. You want to find out, where can I use this? How many counties, how many states can I use these plans? All righty. Are prescription drugs covered just like with HMOs in most cases? Yes. As long as you pick a plan that provides drug coverage, then you'll have drug coverage. With the PPO, you don't have to choose a primary care doctor. You don't have to tell them right away that I want Dr. Bombay. And you, in most cases, don't have to get a referral. And oftentimes you may not have to get prior authorization. So it's similar to like at the job, where you have more flexibility on a PPO. No, it's not the same as original Medicare. A lot of people go, well, that sounds like original Medicare because I've got flexibility. No, original Medicare you can use anywhere in the US, and they don't have networks. You just got to make sure the doctor actually takes Medicare, and that's pretty much the end of that discussion. But with a PPO, you still want to check, are you in network, or am I going to have to pay more if you're not? And can I use it in this state? Again, if it's an ER visit, doesn't matter what state you're in. If it's urgent care or dialysis, doesn't matter what state you're in. But for just regular care, you want to check your geographical area. And PPOs may have some extra benefits that original Medicare doesn't, but you may have to pay for some of those benefits. And when we talk about extra benefits for Medicare Advantage plan, we're talking about fitness coverage, silver sneakers or other type of fitness coverage. There may be some coverage for over-the-counter medications. There may be coverage for opioid pain management, things for people who are chronically ill, things that they may need that they wouldn't be able to get under original Medicare. You may be able to get some of those services or items through a Medicare Advantage plan. So that's what they're talking about with these extra benefits. And then we have Medicare special needs plans. These are plans that are particularly for people in one of three situations. So can you get health care from any doctor or hospital? Again, they need to be in network unless it's emergency, out of area urgent care, or out of area dialysis. Yes, drugs are covered. In fact, all SMPs must have prescription drug coverage for Medicare. Generally, you will have to get a primary care doctor, and generally you will need referrals. Special needs plans are particularly for people who are either receiving both Medicare and Medicaid, or they have a particular chronic illness that allows them to enroll in certain special needs plans, or they may live in an institution and they're able to get a special needs plan based on that. So if you're in an institution, if you have Medicaid as well as Medicare, or if you have certain chronic illnesses, you may be able to qualify for special needs plans, because these plans are going to have certain benefits that cater to those needs. Otherwise, you're going to be in one of those other two categories we mentioned before. All right. And with that, other things. Oh, see, I got ahead of myself. See, 1, 2, 3. They limit those memberships. They may have other restrictions. Whenever people call us about special needs plans, I send them the information that we have, and then I always direct them to call the plan themselves to make sure that they qualify for whatever eligibility that they have. I would rather them get it straight from the plan because they may have extra limitations that we don't know about. And the plan can tell them, yes, you may qualify, no, you may not. Those plans should coordinate your services with your providers. Those plans should make sure that your providers will take both Medicare and Medicaid if you're in one of those. Medicare is pretty flexible as far as providers, but Medicaid's a bit more strict. So you want to make sure that you not only have a doctor that's willing to take Medicare, but also Medicaid if you're in that type of SMP. Or if you're an institution, make sure that your plan's providers serve people in the institution where you are. So that goes back to, if it's not going to work, that's why if you're in an institution, if you're in a long-term care facility, you have a special enrollment period to change plans, because you may find out that, hey, when I was living at home, my plan was just fine. Now that I'm living at this place, it's not working with the providers at this place, and I need to make a change. So that's why the folks with these types of plans in an institution have those special enrollment periods. All right. And so that ends the part that Marcus and I are going to go over. This is just our contact information, which we will give again at the end. You can reach me at afranklin@agingcommission.org, 901-222-4105, marcus.stansberry at agingcommission.org, 901-222-4106. That's our new address. Yay. And then the Tennessee SHIP toll-free line, 877-801-0044. So we're going to turn it over to Lonnie. And again, after her portion, we'll take questions and answers, and we will repeat our contact information at that point. So let me, Lonnie, I'm going to go ahead and try to pass you the ball.
Okay.
And let me know if that worked. It's my first time doing that.
It worked, but now the presentation's gone.
Oh man.
That's okay. I'll get it. Let me find it.
Alrighty.
I'm bringing it up on mine. Bear with me just a second. I'll bring it up on mine.
All right.
Okay, let's see here. Share content. Okay. Alrighty. All right, now everybody, can you see my screen now?
Yes, I can see it.
Okay, cool. All right. So good morning, everybody. So today I'm going to talk about a little bit about the SMP program. I know Marcus went over, pretty much what SMP does. So I'll pretty much skip this. So pretty much what we do is help beneficiaries to prevent, detect, and report healthcare fraud. I help preserve the integrity of the Medicare program, and of course, I rely on volunteers to help me spread the word and things like that. So the SMP mission is actually to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse through counseling, outreach, and education. So what is Medicare fraud? Medicare fraud is the intentionally billing of Medicare for services that were not received, or billing for services at a higher rate. For example, if a beneficiary had a X-ray, yet the imaging place billed for an MRI, that's billing at a higher rate. So what is Medicare abuse? It is providers supplying services or products that are not medically necessary or that do not meet professional standards. I've been dealing a lot with this here lately because I've had, there's the DME brace scam that's going around, and there's a bunch of DME companies that are buying beneficiaries' Medicare numbers from the scammers, and they're sending these beneficiaries braces which aren't medically necessary, and they're getting who knows what kind of doctor to sign off on these. So that scam is actually still going on. I'm still getting referrals about it. So here's some examples of fraud that I deal with on a daily basis. Billing for services, supplies, or equipment that were not provided. That means, the beneficiary never received them. Obtaining or giving Medicare numbers for free services. Claims for services that are not medically necessary. That's those braces that I've been dealing with. And using another person's Medicare number in order to obtain care. So that's just a few of the things I've been dealing with. Here lately, I've also been dealing with a lot of the Advantage plans, calling people, that's the unsolicited phone calls, and signing up people for these Advantage plans back during the Medicare annual open enrollment period. And then, telling the beneficiaries that, yes, they, take all your doctors, or, pretty much lied to them to get them to sign up. I even had one beneficiary, she didn't even know she'd been enrolled in an Advantage plan or switched Advantage plans until her service provider actually told her. And she was actually going through chemo treatment. So this is some of the things that I'm going to be talking about. So how beneficiaries can prevent fraud is, one, protecting their information. There's a lot of scams going around right now where they're calling beneficiaries, claiming to be from Medicare. One of them's claiming to be from Medicare and asking about the pain, and that's the brace scam. The other one is they're calling, claiming to be from Medicare, telling them that they're going to be getting a new card, and getting their information that way. I always tell beneficiaries, if you receive any of these calls, please just hang up. Don't engage with them. Don't do anything. Don't give your information out. Don't confirm your information, anything like that. Just hang up. Another one is, detecting Medicare fraud. In order to detect it, I encourage beneficiaries to read their Medicare statements. That's either their Medicare summary notice if they're on original Medicare, or their explanation of benefits if they're on an Advantage plan. They really need to read those to make sure that what's getting charged is the service that they actually received. And the thing is, if they do find a discrepancy, they need to report it to the senior Medicare patrol so we can actually get the ball rolling on either, getting the fraud report done, getting it recoded if it's coded incorrectly, anything like that. But the important thing is to report it. So here's some things that, as I said, beneficiaries can do to, help prevent fraud. Treat your Medicare card like it's a credit card. Watch out for identity theft. To be aware that, Medicare doesn't usually call people to sell you anything like that. So don't give out your information. Don't carry your Medicare card unless you actually need it. Unless you're going to the doctor or something like that, leave it at home. As I said, beneficiaries can detect fraud by reading their statements. Make sure that you're double checking. Make sure you're checking, your Medicare summary statements and any bills that you get from the doctor before you ever pay them, because on those statements it'll say how much you owe. And I know some people, like if they're on original Medicare, they get and they have a supplement. Make sure you've gotten all of your statements before you pay a bill. Make sure you've gotten your MSN. Make sure you've gotten your statement from your supplement. Or if you're on a Advantage plan, make sure you've gotten your statement from your Advantage plan. Don't pay any bills until you get those and can confirm what you're actually supposed to pay. So, of course, reporting fraud, my toll-free number for the state is 1-866-836-7677. That actually rings directly into my office. So, please give me a call. Some of you actually have my email. You're more than welcome to email me or anything like that. So, keep in mind that if you are talking to a beneficiary, if you're one of our volunteers and you're talking to a beneficiary, I need as much information that you can get if you're talking to that beneficiary. I need, copies of the MSN or the EOB, copies of the bill, anything that you can get as much detail as you can. Because keep in mind, we're probably starting a criminal, I'm starting the beginning of a criminal case, because once I get all the information gathered, I pass it on to the Office of Inspector General. So I need as much detail as I can get. So here's my number. I'm actually in Cookeville, Tennessee, but I do cover the whole state. And of course, before COVID hit, I would travel out to see a lot of you all. So hopefully won't be too much longer before we can get back to our normal hands-on seeing people. So we'll see. But in the meantime, just give me a call. I'm here in the office. So I'm going to be talking about protecting yourself from enrollment fraud, and this is some things that agents can and cannot do. So we'll be going over some of those. So here's some actual rules to remember. Know the rules about how plans and agents can and cannot, contact or market their plans. Know how to avoid potential enrollment fraud. Know how to protect yourself from enrollment fraud, and know how to report, fraud or abuse. So how can beneficiaries avoid enrollment fraud? Watch out for the unsolicited phone calls. The Advantage plans know that it goes against marketing guidelines to call people through unsolicited phone calls unless they have a current, unless that person is a current client. For example, if the client has a Blue Cross Blue Shield in any form, and we're talking TennCare, if they have Blue Care, if they have a Blue Cross Blue Shield Part D plan, they are a current client. So if they're a current client of that company, then that gives that company permission to call them, unless there's some kind of opt out for that company. And I highly recommend, doing that if there is an opt out. But what they need to watch out for is, these callers, pressuring them with time limits. You all know the time limits. You all know, annual open enrollment is October 15th through December 7th. And then we have the Advantage Plan open enrollment is what I call it, is January 1st through, March 31st. So, the time limits. Keep in mind, so don't let the agents pressure you into signing for something that, you haven't done your homework on. Watch out for people who ask for your Medicare number, Social Security number, or any bank information, especially over the phone. Watch out for people who threaten you with loss of Medicare. I think a couple of years ago, we had one agent that was, telling beneficiaries that they would lose their Medicare if they didn't sign up for this Advantage plan. Watch out for the agents who offer gifts to enroll. There is a certain amount that they can offer. I think it's under like $15 gifts or whatever, but they have to actually offer those to everybody, not just people who actually enroll. Watch out for any of the agents who say that they represent Medicare. Medicare does not hire insurance agents. So Medicare itself doesn't. Now the Advantage plans, they do hire or contract out insurance agents. So watch out for, the agents who are, call uninvited, which means the unsolicited calls. If they get, anything like this, please report these to me. Names would be greatly appreciated. I can't just report, I have to have the full name of an agent and the correct name of an agent. I've even had to go on to like Facebook and stuff like that, trying to find the correct name of an agent. Turns out, for example, Bob could be actually turned into a Robert. So just keep that in mind. I need the agent's full name. So to protect yourself from enrollment fraud, protect your Medicare number, Social Security number, don't give them out. Be wary of any unsolicited phone calls. Rely on, government websites or emails for, unbiased information. Unbiased, SHIP is an unbiased program. Of course, you've got the Medicare.gov website, that is unbiased information. Request, translation services if you need it. I know in Memphis you've got several different communities, especially there is one like a little Russian community I know of. So if y'all need translation services, make sure you request that. Confirm everything that an agent tells you before you make a final decision. As I said, I've had agents say that they work for Medicare. I've had agents say that their plan worked everywhere and that their doctor did take that plan when in fact they did not. So just make sure you do your homework first. I always tell beneficiaries, make sure you call the plan first. The plan, you can call the plan itself, or you can call your doctor's office and confirm with your doctor if they take that plan. Make sure you do it, and you have to call all of your providers to make sure that they take that plan before you ever sign up. I tell beneficiaries to do that all the time. So just confirm everything that the agent tells you before you ever make a final decision. Be aware of your rights to choose how to receive, your Medicare coverage. They've already went over those. Do your homework before you sign up. Review the annual notice of change, which is usually mailed out in September. That'll say if any, drug coverage or changes, anything with the plan, if it's changing, anything like that. So, make sure you go over that. Think about what matters most. Does this plan fit your budget? Does it cover all of your drugs? So look at things like that. Ask all your physicians, hospitals, durable medical equipment suppliers, anything that you might be using, nursing facilities, anything, if they take that plan. And again, check for star ratings. Check to see if there's been any complaints or anything like that against this plan. Do your homework first. That's how you can protect yourself from enrollment fraud. Again, rules for meeting with an agent. Here's some handy tips I give beneficiaries. Make sure that they give you plan materials, so that's something that you can actually look at to make sure it's correct information. Or if they can tell you to get more plan information. Most of the time you can go online to the company's websites and look at the plan information. Make sure that they are only discussing, like Advantage plans. If that's why they're coming to your house, make sure that they're only discussing what you agreed to discuss. Make sure they give you an enrollment form. Make sure it's not already filled out. Make sure the agent, doesn't pressure you during this. If you're doing, make sure, if you want to sign up with this plan, make sure you complete the form and make sure you give it to the agent. I mean, the agent can actually leave business cards for you to give out to family and friends. You don't have to. But the agent cannot request names and stuff from you to call later on. They can give out business cards for you to hand out, but that's up to you to do that. So just some things to keep in mind if you're meeting with an agent. So make sure that the agents can't charge you a fee to process your enrollment. They can't steer you to a particular plan. For example, if they work for Blue Cross Blue Shield has several different plans. They can't steer you to the higher costing plan when the lower costing one, or the one with the zero extra premium, would work just as good. Keep in mind, agents work off commission. So keep in mind about that. Make sure, during the meeting, that they don't communicate any incorrect information. If you do, I could probably get you a special enrollment period. The ones I've talked about, I had to get a special enrollment period for them and get them switched to either their old plans or to a new plan. Make sure they tell you about other plan options that that you haven't agreed to discuss. For example, there's agents out there that sell all sorts of things. They sell life insurance. They sell your Medicare Advantage plans. They sell all sorts of different things. So make sure that when you're sitting down with an agent, that they're only discussing what you agreed to discuss. Make sure that they don't pressure you into signing for something, especially over the phone. I really tell beneficiaries, please don't sign up for an Advantage plan over the phone unless you've already sat down and talked to the agent, done all your homework and things like that. It's just easier that way. Some rules for agents. They can't ask you to give you names, as I said before. They can't ask you to sign the enrollment form before you're ready to join. So that's what I'm saying. Make sure that the enrollment form, if they give you one, that you don't fill it out and sign it before you're ever ready to join. So here's some examples of enrollment fraud that I've dealt with. Of course, I had an agent enroll a beneficiary into a plan without their permission. Agent told the beneficiary that their physician takes the plan. Agent offers free trips, meals in return for signing up. Agent misrepresented the plan's benefits. I had an agent tell a beneficiary they have to sign up or they will lose their Medicare. I've actually had all of those happen before. So just keep in mind, here's some, and who knows, they can come up with all sorts of other, but this is the main ones that I usually deal with. So here's what to look out for. Bogus Medicare representatives. As I said, agents, Medicare does not employ insurance agents. Things to look at: threatening for loss of coverage, go ahead and just hang up. Fake rebate notices, counterfeit sales materials, and believe me, they're out there. That's why you need to check the websites first. And the fake emails. So scammers are everywhere. Just keep that in mind. They're email, phone. I mean, they're everywhere now. Of course, how to report Medicare fraud, you just, give me a call. If you can get as much information as you can, any papers that, any copies of the papers, any copies of the materials that they gave you, business card is very helpful, anything and everything, like the date that the agent called, anything and everything as detailed as you can is very helpful. Just get me the information as soon as you can, so that I can get them, switched back if they're needing switched back. For example, I had one lady, as I said, she didn't know she had even been switched. I had the Kirkland Cancer Center in Jackson is the one that actually called me regarding her. And they said that she didn't even know she'd been switched, and she had to actually miss a chemo appointment to get her chemo because she had been signed up for a plan and didn't even know it. So, please, if you get these unsolicited phone calls, I've been, tell the beneficiaries all the time, if you get these unsolicited phone calls, just hang up. Don't talk to them. Don't do anything. Just hang up. Fortunately, I did get her switched back to her old plan, so she didn't miss her next chemo appointment, but I had to do it very fast, and I sent it actually to CMS as a rush so that they could get her pretty much immediately back onto her old plan so she wouldn't miss any more chemo. Of course, I'm going to talk to you about some of the current scams that's going around. Right now, there's a lot of COVID-19 scams. We've got, back we were dealing with a lot of the mask scams and all sorts of stuff. Now we're dealing with a lot of the vaccine scams. So keep in mind with those, Medicare does pay for the vaccine. So you don't have to pay, anything out of pocket for the vaccine. The other scams that's going on right now, I said that Medicare brace scam. They're calling beneficiaries claiming to be from Medicare, asking about their pain, and that they can get free braces from Medicare if they can just give them their information. Social Security scam, we've had that been going on. I haven't heard that one here lately, but they were claiming to be from a investigator from Social Security, and that they owed, the Social Security number had been used fraudulently in Texas or something like that, and that there was an arrest warrant out for them. That was a scam. Of course, with tax season upon us, we're going to have IRS scams starting. So, keep in mind, and I'm telling you, scammers are everywhere now. Email, phone. I mean, you cannot hardly trust anything now that you see by email, on the internet, anything. So if you hear of any of these, and if you hear of any new scams, please let me know so that I can get them reported, especially the COVID-19 scams, especially any vaccine scams, anything like that. Please let me know so I can get them reported to the OIG. So here's some of this COVID-19 scams I've been dealing with. Sending faxes to doctor's office for signature of a COVID test, kits, or mask. Even though the doctor, when I talked to the doctor's office, they said if they wanted a mask, they can just come by here and get one. We'll give them one. Free virus test kits in exchange for your Medicare number. Imposter scam using COVID-19. Some were claiming to be, working for the health department. Most of the time, if the health department's calling you to, with your test result, or, come in to get a test or whatever, they're not asking for the Medicare number. So watch out for those. Grandparent scams. Hey, I'm stuck in whatever county because of the virus and I need, money or whatever. Unauthorized test kits that were sold online. The at-home test kits, that they weren't FDA approved. The phony coronavirus contact tracers, as I said, those contact tracers, yeah, they were probably telling you that you might have been exposed to, the virus, but they were not being asking for your Medicare number. That's the thing. These, the scammers would, the real people would not be asking you for your Medicare number. The scammers would be. Selling fake cures on social media. And of course, their email or text messages claimed senior was in contact with someone who had COVID, but they asked for their Medicare number, asked, people to follow certain links to capture, private information. So as I said, you can't hardly text message, email, you can't trust anything nowadays. The brace scam, I said, that they're calling, Medicare or claiming to be from Medicare, offering free or low cost braces, or boxes of braces are just showing up at people's houses, and beneficiaries never heard of the doctor that prescribed any of them. Another thing that they're faxing the doctor's office for signatures for the braces. So keep in mind, if you ever go to your primary care physician, ask your physician if they've gotten any faxes regarding you for durable medical equipment. I tell beneficiaries, if you're needing, anything like that, go to your primary care doctor. Your primary care doctor can, prescribe it for you and send you to a local company so that you can get, properly fitted and things like that for the braces. The Social Security scam, I said, those actually need to be reported to the Social Security OIG. And here's the number for that. Their number is 1-800-269-0271. So if you hear anything about the Social Security scam, please report it to the Social Security Administration Office of Inspector General. IRS scam, it needs to be actually reported to the IRS. And the IRS is wanting, as much detailed information as you can get. And there's actually a website that you can report it at. It's phishing@irs.gov, and that's the phishing is with a PH. So here's my Tennessee Facebook page. I actually forward several, sometimes quite a few times a day, scams that's going on, anything like that. So please go and like my Facebook page. I'm trying to get as many likes as I can. So if you're not on there, please go and like my Facebook page. I said I post pretty much daily any, fraud that's going around, any scams that's going on, anything like that. So please go and like my Facebook page. I'd really appreciate it. And here is my contact information if you need anything. So as I said, here's my toll-free. That toll-free number rings directly into my office. Here's my email if you need it. Fax number, anything. So if, you all, don't hesitate to call me, email me, anything. And I want to thank you all for listening to me. So I guess we're open for questions, and I'm going to try passing it back to you, maybe.
All right. And yes, we are open for questions. Thank you, Lonnie. Thank you, Marcus. Thank you all for coming. So if you have any questions, I do believe there were a couple in the chat, so I'm going to scroll through and try to get them. Again, you can chat a question or you can unmute and just go ahead and ask your question. And let me see. It looks like, yeah, I figured out after the fact I was to blame for the background noise. Sorry, guys. Okay, Sandra asked, what do you mean for 2 months? Can you clarify? I think I know what you were talking about. Were you talking about with the Medigap trial, right?
Yeah, I think you just said 2 by mistake, but I kept listening. I think you meant 12 months.
Well, they were actually, I probably said both. So the 12 months was if you are, so again, if this is your first time, let's say you're 65, you join a Medicare Advantage plan, in the first 12 months, you can go back to original Medicare, and that will give you a guaranteed issue right to pick up a Medigap plan. Now, that guaranteed issue right is the one that's for 2 months. So anytime in the first 12 months, you're in the Medicare Advantage plan, you just turned 65, you can say, hey, I want to go and do something different. Let me go to original Medicare. And at that point, you can call the Medigap plan. And because the reason it's 2 months, let me go back. If you're on original Medicare, when you first take Medicare Part B and you're at least 65, so both of those things need to be true, because as we know, if you're on disability, you're going to be younger. But if at least 65 and this is the first time you've taken Medicare Part B, you have a 6-month guaranteed issue right to get a Medigap plan, that's supplement insurance, where they can ask you medical questions in order to determine your eligibility or to determine the premium. They just have to give you whatever the best rate is for you at that time for people who are entering the plan at that time. So that's typically a 6-month guaranteed issue right. Now, you get Medicare Part B and you decide at that moment, hey, I'm getting Part B, I'm gonna get a Medicare Advantage plan. So you've got 12 months if you're just turning 65, or if this is your very first time getting to a Medicare Advantage plan, you've got 12 months to go, I want to go back. And so you can go back. At that point, you will have a 2-month guaranteed issue right to get that supplemental. Because in most cases, you might have blown through that first 6 months. Now, if you're still in that first 6 months, hey, but let's say you've blown through that. Let's say you've been on this Advantage plan for 10 months now. So you've gotten rid of your 6-month window. You've been on this Advantage plan for 10 months and you've decided for whatever reason it's not working for you. Maybe you need more flexibility. Maybe you need to go to multiple doctors. Just too many to coordinate in one Medicare Advantage plan. Maybe you need to go out of state more often than you thought you would. So you want to go back to original Medicare. If you do so, now you've picked up a guaranteed issue right, and that's the part that's 2 months. Any other questions? Like I said, feel free to unmute yourself and ask, or if you prefer, you can type your question in the chat. And it could be questions over any part of the presentation, any part of Medicare Advantage plans, anything about fraud or fraud prevention, what agents can or cannot do. Because, of course, we want to make sure that we all understand, Medicare Advantage plan agents, as Lonnie said, don't work for Medicare. They work for, those companies, or maybe they're part of a brokerage. Now, there are many agents out there who are ethical, they're above board, they're doing their job. Being illegal. We're talking about the ones who are not doing what they're supposed to be, the ones who are not following the rules, the ones who are misrepresenting themselves, the ones who may be misrepresenting Medicare or what your rights are. Those are the ones we want to make sure that you watch out for. So we don't want anyone to say that, hey, they're bashing Medicare Advantage agents. No, there are plenty of agents across the board who they're doing their jobs to the best of their ability. Now, of course, they're not unbiased. If you work for Blue Cross Blue Shield, obviously you're going to hype Blue Cross Blue Shield. But as long as you're telling the truth, hey, I'm telling you about my stuff. I'm not going to tell you about WellCare because I don't want you to go over there. But hey, we're the bomb. This is what we have. And they're honest about what they have. And they're not tricking you or trying to scam you. That's cool. But we just want to make sure that when you are dealing with agents, that you know what your rights are and you know what they are allowed to do and what they are not allowed to do. So that if you do run across a few bad apples, not only can you protect yourself, but if you or a loved one happens to have done something or gotten yourself in a situation that's not working for you and there may be a violation, that's when you want to make sure that you contact Senior Medicare Patrol. You call Lonnie at her phone number or at her email, and we will be emailing these presentations that have all of our contact information to everybody because I've got all of your emails when you signed up. So that's what we want to make sure that you're dealing with people with good intentions. And if not, you let us know. And it's also why SHIP is here. Like I said, if you're dealing with someone from Blue Cross, even if they're upstanding and doing their job, which is cool for them, they're not going to tell you all of your options, just their options. But if you contact SHIP, we're unbiased. So when we go to Medicare Plan Finder, we're going to say, hey, here's some options with Blue Cross. Here's some options with Humana. We're going to let you, to the best of our abilities, what's available, what their costs are, what their structure. And then that should give you the information so that you can make the decision that's best suited for you, which plan you want to go with. And if you decide that you do need to talk to, let's say after we've given you a bunch of information, there might be some things that we just have more nitty gritty details. You call that group and then they can give you details on that. But we just want to make sure that you get the most informed, be able to make the best informed decision possible. All right. I don't see any questions in the chat. Anyone have any question for us? Or what I do, let me do this. Let me see if I can find the record button. I'm going to stop recording because I know sometimes people are like, I don't want to be on recording asking that question. So I'm going to go ahead and stop recording and